Well, and obviously we're incredibly lucky to have you, so let's get into it. The Ebola crisis, 2014 to 2016, was an extraordinary event. We tend to think today that COVID-19 is unprecedented. When you look back at Ebola, or when you use Ebola as a lens into COVID-19, what are the high points, do you think?
So I think about 6 years ago, it was only 6 years ago when 40% of Americans said they were terrified of this deadly disease called Ebola. And it was ravaging Sierra Leone, Guinea, and Liberia. These three West African countries took an absolutely devastating loss of over 11,000 lives. And the mortality rate of Ebola was estimated at 40%. So there was this huge panic. And then once the epidemic waned, Americans and much of the world simply lurched from panic to complacency. So bioethics is practical. And if there's nothing else that I take really seriously about bioethics, it's that it helps us learn from our history so we don't repeat it. So let's compare essential facts about Ebola and COVID-19. Both are highly contagious, but Ebola transmits only by contact with blood or bodily fluids, while COVID-19 also infects by airborne particles. This is very relevant. Individuals without symptoms can't transmit Ebola, but they can transmit COVID-19. As I said, Ebola has a 40 to 50% overall fatality rate compared to 1 to 3% estimated for COVID. So keep in mind this high mortality rate of Ebola, and let's compare the death tolls. 11,000 plus for the 2 years of Ebola epidemic compared to 170,000 and more to come for the ongoing COVID pandemic. So with 2.5 million recorded cases of COVID-19, we're lucky. It's hard to say that, but we actually are lucky that COVID-19 is not nearly as lethal as Ebola. So going back during the Ebola epidemic in the United States, there were 4 cases and 1 death. Huge panic. There were travel bans and quarantines that were called even for asymptomatic healthcare workers who are not contagious and who are absolutely essential to containing the disease. So once the Ebola threat waned, the U.S. and global response lurched again from fear to complacency and inaction. So viruses don't respect political boundaries, but the United States got off relatively lightly, not only from Ebola, but from the epidemics of the past 2 decades, from SARS, from MERS, from H1N1. So the real question is, will we learn this time not to lurch back into complacency? I would say it's better to learn the hard way than not to learn. And we are learning the hard way, I hope.
So you didn't want to be complacent after Ebola either, and your commission did a report for President Obama on the profound ethical issues associated with the provision of public health during pandemics. What are the things from that report that you consider to be salient in the context of COVID-19?
So I would choose of our the issues that we underscored 7 big issues. I would choose 3 key issues to share with this class that our commission emphasized that are critically important today. First, since viruses cross borders, the United States needs to strengthen the capacity of the World Health Organization, the WHO, by tying increased funding and collaboration with the WHO to making sure the WHO streamlines its rapid response capacity. There has to be a global response if we're going to cut down on lives and reboot economies quickly. Second, the president needs to identify and empower an experienced health official to coordinate all public health emergency activities in the United States. Tony Fauci would be a superb choice. President Obama picked Ron Klain, who was not an expert in public health. He did a terrific job, but he was appointed late to the task, and he himself agreed with our recommendation. There needs to be a single public official who has health expertise to coordinate efforts. And third, and I would say this is just so important right now, the federal government needs to strengthen the deployment capabilities of the United States Public Health Service. We called for that. This is a radically under-resourced yet vitally important agency. Of the massive amounts of money that the U.S. spends on healthcare, we only spend 3% on public health. So we need massive testing, we need contact tracing capacities, and that requires a battalion of trained individuals in public health.
So let's move from decisions to decision making. Making decisions under stress when the stakes are unbelievably high, that's about as hard as it gets. So if you reflect on the decision-making process, what are the key considerations you've kept in mind as you know you've got to make decisions with a lot of uncertainty out there, and you know that all of your actions are going to have enormous knock-on consequences. How do you discipline yourself in that decision-making process?
So I've been reflecting on this because earlier this month, the presidents of major universities from around the world met via Zoom, from Singapore and Shanghai to Seattle and South Africa to Switzerland. We're all on a Zoom. And I was asked to begin the meeting by answering your question, Geoff, that very question. And the way I think about it is that it's really important for Penn to be guided by a new 3 R's. The 3 R's I grew up on in education were reading, writing, and arithmetic. They weren't spelled very well, right? But the new 3 R's are, first, be resourceful, and be prepared to be resourceful. We need to ensure the health of our people. We need to support our frontline health professionals. And we need a process in place to direct our resources to meeting the demands, both of the hour and to sustaining our long-term mission. And that's the challenge of being resourceful. You have to be prepared to make, with a team, to make decisions that are wise in the short term, in terms of crises, but also sustain the long-term mission. So that's one. The second R is to be resilient. Angela Duckworth famously teaches about grit and resilience. It's not just an individual characteristic, it's also an institutional characteristic. We needed to be resourceful and also resilient enough to move to teaching and learning online in a week's time. We had the online teaching initiative already going. We had invested greatly in blended learning, and we will undoubtedly invest more in, but being resilient was really important. And we're also adjusting institutionally as well as individually to being physically apart, which is, as hard as that is, it's the easy part compared to being physically apart while finding new ways of being more connected. So that's where resilience comes in. And that's a process too. It's a team process of really being able to brainstorm together and being able to pivot in a way that universities are not typically renowned for doing. And I really am proud of Penn for being able to do it. And the third principle, if you will, which is also a practice, these principles are practices. In my mind, ethical principles always have to be practical, is to be responsive, to care for patients, to make sure we're caring for our caregivers and caring for other workers whose lives and livelihoods are at risk. So that's why we created an emergency relief fund That's why yesterday I wrote that we're replacing the summer earnings expectation for our undergraduates on financial aid. So be resourceful, be resilient, be responsive. It's all a team effort. And I'd add to be absolutely frank and humble about the fact that these have been the hardest decisions in all my years and our years as university leaders. In a pandemic, the timeline of decision-making is drastically compressed. I really believe, and I've written about this, I've studied it, I practice it, and you deliberate and you decide. You deliberate really broadly, and then you make decisions. And we know that every day we didn't delay made a difference in saving lives. So I've long said that our number one strength is the quality of Penn people. And this crisis, Geoff, is proof perfect. I mean, Penn people rapidly made incredibly difficult changes in their lives. And they did it with the spirit of everyone doing their parts to help an urgent and collective cause. And they did it because of resourcefulness, resilience, and responsiveness. And so that's part of the process.
Well, I think on behalf of everyone, I'd just like to thank you for the extraordinary job you've done under unprecedented, to my mind, unimaginable circumstances. You know that we asked the students to submit questions in advance, things they'd like to hear from you on. And we both read all of the questions. So we thought they were fantastic. About 100 questions from students. And I want to go through some of them, but neither of us was surprised that the most frequently asked question was, what about the fall? What can you tell everybody who's online today about your thinking on where we are with respect to what fall will look like?
So for all of you who asked about the fall and those of you who didn't ask but are still thinking about it, what I know for certain is how much I want to restart our campus-based activities. We can't yet know precisely when, but I know that we will do it as soon as we can. And what we're doing is we're actually planning for the best path forward to a full recovery. We cannot know how the current pandemic will play out in the months ahead, but what you can know is that we're with our health system and the team that includes a wide range of expertise. We're planning for every possibility, ramping up our own capacities, following expert guidance. And I know for certain that we will start up as soon as we can. I just don't know exactly when. And the last thing I want to do is announce that we're coming back at a date certain only to have to change that. I'm
going to now start mentioning students by name because we did ask some students whether we could shine a light on them with their fantastic questions. And the first one's about the future of higher education, and it comes from Amanda Lewis, who's a Wharton undergraduate. And her question to you is, I think, a profoundly important one. How do you think COVID-19 and the sudden transition to virtual instruction will affect the future of in-person education?
Well, first of all, thanks, Amanda. It's a great question. Penn we've been a pioneer through our online learning initiative, Amanda, and our early role in Coursera. However, I've always said that virtual learning will supplement, not supplant, in-person, much more engaged and much more interactive learning. So our faculty and students get enormous credit for transitioning to 4,000 courses online in record time. And I'd say the overwhelming reaction is captured by many emails that I've received from students and their parents who report how well the virtual instruction is working. But every single letter I get that says that also says how eager students are to return to campus-based learning. So post this interruption, this disruption, I expect there'll be more and better blended learning. I think we will learn a lot that can be translated into improving campus-based in-person learning. But the future of in-person education at Penn, Amanda, has never been more certain.
What advice would you give on managing personal stress through the pandemic to ensure that everyone's able to make high-quality decisions and project empathy to your team was the question, but I think it holds more generally. So how would you advise people manage personal stress?
In this pandemic, knowing how to relieve stress, James, is part of staying healthy and productive. So you've just hit it spot on. So here, let me give 3 pieces of expert advice that I'm going to give, but I have to tell you, I also have it in my mind to take this advice. It's first, get exercise and sleep. They're proven to make us happier and more productive. Okay? Second, find ways to do something for others. You can make face masks and uplift people with homemade musical performances. The Penn Band, Penn Masala, the Shabbatones, the counterparts have all uplifted me and thousands others through that. You can tutor online. You can deliver food for someone who is housebound. You can console those who are grieving. I list those, most of which I've done myself, except musical performances, because you wouldn't want me doing the singing. But you will get back far more than you give. And the third, which I have to say is in some ways the most basic part of empathy, is to express gratitude. Every day, I reach out and thank people who make Penn such a creative and compassionate community. I ask them to be sure to take good care of themselves. And I know many of you are also doing this because I've been the grateful recipient of your messages. And Geoff, if you'll permit me, I'm going to share one. I brought one with me. I'll find it. That speaks volumes about this very class. So let me read you from a message I received several weeks ago. I'm reaching out to thank you for all of your hard work in making sure the Penn community is safe and can still experience the unparalleled education we have all come to appreciate. I know that you made many very difficult decisions over the past few weeks related to graduation, on-campus living, wages, and so much more. You have handled this unprecedented situation with grace, and your decisions make me and many of my peers feel so much safer. My professors have also done an incredible job transferring their classes online and teaching with the same passion as they did earlier in the semester, as has the entire team working on the COVID-19 class in Wharton. And this was long before anyone knew I was going to be in this class. In a time like this one, it is easy to feel anxious and fearful, but our Penn community has only provided me with pride and hope. Thank you very much for all you do and all your team does. So my thanks, James, to you and your classmates in the COVID-19 team for all you do, because you make me proudly Penn.